If your child has Osgood Schlatter, you may have multiple questions. First thing to note is Osgood Schlatter is common in active kids, it's manageable, and it usually improves with the right plan. In this video, we will walk through what it is, why it happens, what helps, the general recovery timeline, and a few red flags. So what is it? Osgood Schlatter is irritation right where the patellar tendon attaches to the top of the shin bone just below the kneecap. It's not a torn ligament, and it's usually not a dangerous injury. Think of it as an attachment point that's getting overworked during a time when your child is growing fast. Osgood Schlatter sounds scary, but it's really just describing the location. It's pain at the front of the knee, right below the kneecap where the tendon pulls on a growth area. Here's why it shows up during growth spurts. During a growth spurt, bones can grow faster than muscles and tendons can keep up, so muscles can feel tighter and the pulling force at the front of the knee increases. And that spot on the shin is still developing in kids, so it can be more sensitive to repeated pulling. Now, why does it hurt? Every time your child runs, jumps, sprints, or kicks, the big thigh muscle in the front of the leg pulls through the patellar tendon. That pull lands right on that spot below the kneecap. When the total load gets too high for too long, the area gets irritated and sore. In youth sports, the most common triggers are a sudden increase in training volume, lots of sprinting and jumping, tournaments with multiple games, and tight or fatigued muscles during a growth spurt. It's usually not one single moment, it's the total workload stacking up over time. So what usually helps? The goal isn't to push through pain. The goal is to calm the irritation, improve flexibility of the tight muscles, keep your child active in a smart way, and rebuild strength so the knee can tolerate the activity again. Step 1. Calm it down. For a short period, reduce the biggest pain triggers. That usually means dialing back hard sprinting, repeated jumping, deep knee bending, and back-to-back high-intensity days. Introducing stretching before and after practice will help to prepare the muscles for the sport activity and will help to reduce the effects of significant muscle tightness after the growth spurts. Many kids can still practice, just with adjustments. Step 2. Build back up. As symptoms settle, gradually rebuild strength and tolerance. That usually includes gentle strengthening for the quads and hips and a gradual return to sprinting and jumping. Recovery matters too. Sleep, rest days, daily stretching, and spacing hard sessions. A few comfort tools can help. Ice after activity can reduce soreness, and some athletes find a patellar tendon strap or taping can help during sports. These don't cure it, but they can make activity more tolerable. Now, what should you expect for timelines? Osgood often improves in phases. Think calm the flare, rebuild tolerance, and manage it during growth. Many kids feel noticeably better within a few weeks with smart changes, but flare-ups can return during growth spurts or tournament-heavy weeks. The good news is, as growth slows down, this typically becomes much less of an issue. Finally, red flags. Most Osgood is straightforward, but follow up with a clinician if you notice major swelling of the whole knee, pain that wakes your child at night, fever or illness, a major traumatic injury, the knee locking or giving way, or pain that keeps getting worse even after you reduce activity. All right, quick recap. Osgood Schlatter is irritation at the attachment just below the kneecap, and it's especially common during growth spurts. It hurts because running, jumping, and kicking repeatedly pull on a sensitive growth area. What usually helps is reducing the biggest pain triggers for a short time, improving flexibility, rebuilding strength gradually, and being smart with recovery. Thanks for watching.